Nicholas Cassimatis, and I'm going to be presenting the assessment of spine patient preferences for the location of office-based and supervised home-based physical therapy in the time of COVID-19, an analysis of patient surveys for quality improvement of a single neurosurgical practice. The authors have no conflicts of interest or disclosures to report. So for an introduction, physical therapy is a valuable tool in the treatment of spine conditions, as not all patients are candidates for surgery. Even those that undergo surgery often need physical therapy after. So it's a big piece of really treating patients within spine. When patients do have spine surgery, physical therapy has been shown to improve functional outcomes following surgery long-term and in the short term. However, increased out-of-pocket costs for physical therapy have decreased patient utilization, and the recent COVID-19 pandemic has decreased physical therapy utilization even further. Supervised home-based physical therapy is an alternative to office-based physical therapy, but presents challenge of patient adherence. So our objective in this investigation was, in order to improve the use of physical therapy in the treatment of spine patients, we surveyed patient preferences between office-based and supervised home-based physical therapy in the time of COVID-19. This was an investigation for quality improvement of a single neurosurgical practice. For our methodology, we made a survey measuring patient age, vaccination status, fear of contracting COVID-19, and a preference of physical therapy location was given to spine surgery candidates at a single practice. A total of 57 surveys were completed by patients. The surveys measured patient age, gender, vaccination status, fear of contracting COVID-19, and preference of physical therapy location. Supervised home-based physical therapy was defined as having physical therapists teach patients to perform exercises with them initially, with periodic supervision and check-ins thereafter as the patient continues to do therapies at home. In both settings, the patients were informed that the maximum amount of precautions would be taken to minimize the spread of COVID-19, whether masks, sanitization, COVID testing, etc. As far as the pros and cons of each location, because we did want to inform the patients of some of the decision-making process and what things may be valuable to them in deciding their preference. For the office-based physical therapy, there's more guidance. You have access to better equipment, but it's more expensive and substantially less flexible than a home-based program. For the supervised home-based physical therapy, it's much more flexible. It's a lot less expensive, and this can be a pro or a con depending on the patient, but it's a lot more autonomous. And one other thing that is more likely to be a con for most patients is that you have limited equipment compared to being in a physical therapy office. So for our results, and one important thing I want to mention prior to diving into those is that these surveys did not influence where a patient actually did their physical therapy. It may in a more abstract sense, but there was nothing binding, so to speak, about a patient noting their preference on this survey. So a total of 57 surveys were completed by patients. Between preferences of physical therapy location, no difference was really observed in regards to age, gender, or vaccination status. Additionally, there was no difference in regards to vaccination rates between gender or age of the patients. The majority of patients favored office-based physical therapy, with 58% citing that, as opposed to 42%. Patients who favored supervised home-based physical therapy had higher fears of contracting COVID-19 in performing activities of daily living and in healthcare offices, compared to the patients who preferred the office-based physical therapy. Additionally, more females tended to prefer office-based physical therapy as opposed to males. So Here we have one of our tables summarizing many of the results of the survey, kind of showing the different demographics, how many patients answered for each. Again, we can see some of the percentages we were just talking about, but for those that I think one of the more notable ones on this page, the fears of COVID. So the bottom two rows show substantial differences for those who did fear or did not fear COVID as far as which setting they preferred. So patient preference for physical therapy program, again, overall, 57, almost 58% preferred the office-based. Far fewer at around 42% preferred the home-based. When we break it down by gender, we can see of those that preferred the home-based, more were male, and of those that preferred the office-based, far more were female at 63% for that. So patients who responded as having higher fears of contracting COVID-19 in healthcare offices had significantly higher rates of vaccination than patients who did not, meaning those more fearful of contracting COVID-19 in healthcare settings got vaccinated 89% of the time, as opposed to 66% of the time for those that did not substantially fear COVID-19 in healthcare settings. Furthermore, the patients with higher fears of contracting the COVID-19 in healthcare settings tended to prefer the home-based physical therapy programs. Again, so only 33% of those who had a high fear of COVID contracting a healthcare office preferred the office-based. Most of the patients in that category of high fear preferred the supervised home-based program. Patients who were older than 50 reported higher fears of contracted COVID-19 than those of the younger ages, which I think is no surprise. Despite the differences in fear, there was not really a difference in patient preference for supervised home-based or office-based between older and younger patients, however. Here we can see the vaccination status by fear of contracting COVID-19. So those with low fear, only about 2/3 got vaccinated, whereas those with high fear, almost 90% got vaccinated. As far as the patient preference for physical therapy by fear of contracting COVID-19, again, we played this out in a few of the other slides, but here's just the visualization. Those with low fear substantially preferred the office-based. Those with high fear did prefer the home-based, but not by a substantial margin, to the point where arguably it's negligible. As far as fear of contracting COVID-19 specifically in the healthcare setting, those who were older than 50 were much more fearful than those who were younger than 50. As we can see here with, again, almost 2/3 of the patients that are older than 50 having substantial fear, whereas of those less than 50, less than 1/3 had a substantial fear in a healthcare setting of contracting COVID. So our main takeaways, our conclusions: the patient preference for supervised home-based physical therapy is strongly influenced by fear of contracting COVID-19, and this may be able to be extrapolated to fear of contracting other illnesses going forward. Again, COVID likely being an inflection point for a lot of patient perspective, as I'm sure it is for all those in healthcare. Preferences for completing physical therapy in an office-based environment may provide initial benefit, but may not really provide the long-term outcomes that those who do the exercises on their own end up experiencing. And there's plenty of studies that support that. So long as there's intermittent provider supervision, it seems that those that take a more bull by the horns approach, so to speak, and really take ownership of their physical therapy and continue to do that at home, really with some intermittent guidance, really experience the best long-term results. Further studies really are needed, right? Because this post-COVID world, if you will, is completely unknown. We don't know how people will react going forward, and how strongly the pandemic influenced them. So we really need stronger studies to look into the preferences that different patients have, as well as the long-term physical therapy outcomes in either setting, whether home-based or supervised, office-based or supervised home-based. And that is all we have for this presentation. So thank you for hosting us. We really appreciate it. And if there are any questions, feel free to reach out to me via email at the email listed here. Thank you again, and have a wonderful day.